Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by AACN's membership, offering members special discounts, clinical resources, and unlimited free CEs, with information on how to join available at www.aacn.org/discoverAACN. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to AACN's Voices in Nursing podcast, where we elevate the stories, insights, and impact of nurses. This is Dr. Vicki Good, AACN's Chief Clinical Officer, and I'm joined by Andrea Schmidt, one of AACN's Clinical Practice Specialists.
Hi, welcome to today's podcast. Today's conversation is going to take us far beyond the walls of a traditional hospital. I am honored to introduce our guest today. She's a remarkable bedside nurse from Children's Hospital of Los Angeles. And not only does she provide expert compassionate care at her home base, but also carries that commitment halfway around the world through her volunteer work with Mercy Ships.
Mercy Ships deliver free, life-changing surgical care to patients in countries where access is limited, bringing hope and healing and dignity to communities in need. And it's nurses like our guests who make that mission possible. They offer their skills, their time, and their hearts to serve where the need is greatest. In this episode, we're going to explore what it means to practice nursing across cultures and settings, how global service shapes professional purpose, and the powerful reminder that nursing excellence knows no borders. So please join me in welcoming today's guest, Laura Tice, a dedicated pediatric nurse and a global volunteer whose voice powerfully reflects the best of our profession. So let's dive in.
So Laura, welcome to the Voices in Nursing podcast. Very excited to hear your story. So how about we start with an introduction of yourself and your nursing career to our audience?
Yeah, well, Andrea and Vicki, thank you so much for having me on the podcast. It's an honor to be here. Like you said, I am a pediatric nurse by background. Little people are the best people is kind of what we say sometimes. And I have always had a love for global health. The nursing school that I actually picked had the opportunity for us to study abroad in nursing school. And so at that time, I was able to go to South Africa for 3 months to be a nursing student and learn from how they were performing nursing over there. And I think ever since then, I've just had a love for community health in an intercultural setting. And as I've gained experience over the years, I've just gained more love for it and seen more opportunity to serve in that capacity. As far as Mercy Ships goes, I love it because there are 5 billion people globally that do not have access to surgical care. And the strategy behind Mercy Ships is that you bring the care to them in a stable environment on a controlled ship, climate controlled, all of those things to make sure it's a safe hospital environment. And 50% of the world's population lives near a waterway, near the coast. And so it's an excellent model to be able to get those healthcare services to underserved populations around the world. So Mercy Ships is an incredible organization, and it seemed like the perfect bridge of what my professional passions were.
It's so very interesting. I can't wait to hear your story. I have so many questions. I'm sure Vicki does too.
Yeah, so what new clinical skills or medical conditions did you encounter on board Mercy Ships that you don't typically see in your home practice?
Yeah, well, I think the best analogy I can give is that during COVID, right, we saw this delay in care for a lot of patients. So we would have these preventable cancers popping up years later, and it was very strange for us as nurses because like years ago we would have taken care of that in the first couple months, but now we're seeing it progress 3 years longer, and it was a very foreign. It was foreign to us. And I think that that's kind of what I was seeing on Mercy Ships was these conditions that we would normally take care of very earlier on, but they had progressed so far because they didn't have access to care that things would become much, much more severe. So for example, in the US, we primarily we'll repair cleft lips around 3 to 6 months, cleft palates around a year. Well, I got to take care of a patient, he was in his 50s, and he had a cleft lip and a cleft palate. And that's just something that we would never normally see here. The healing process when you're in your 50s is very different than when you're, 6 months old. Just the impact of all of that socially. And I asked this man, like after he'd had his full repair, what he was going to go do when he went back to his village afterwards. And he told me, I'm going to go kiss my wife. And that story is just so beautiful, the humanity behind it, but also just the contrast between the accessibility to care and what happens when those things are not accessible. So that was one case that really stood out to me of just medical conditions that get prolonged and we can't intervene.
Obviously, it's pediatric and adults then?
Yeah, that's a great question, Andrea. So yeah, the setup on the ship is very different than what we have in a hospital. So it's not quite as divided of this is the pediatric ward or the pediatric hospital or this is the ICU. I'm a pediatric nurse, but when you sign up to work with Mercy Ships, you're a nurse. And those skills go, across the board, not just for what you're comfortable with in your home setting. And so what would happen is every nurse is a ward nurse on the ship. And if they have a need for like an ICU patient that needs pressors or is intubated or those kinds of things, then they will open up an ICU bed that's always reserved for those patients. And they will pull the ICU nurses from the ward and have them take care of those patients in the ICU bed. But if there was not a need for ICU level care for patients, then everyone is a ward nurse. So for example, we'd kind of advertise ourselves like, I'm an ICU nurse, I'm a peds nurse, and it would say on our badge. So whenever anyone would kind of get a little bit nervous about, if they're taking care of a 2-month old, there was a lot of intention around what nurses were assigned those patients based on our home subspecialties. But it was also really fun for me to get to take care of adults who could talk to me and tell me what was going on. And so for ICU nurses that might be listening to this podcast, there is such a broad range of skill sets that you have. And on Mercy Ships, you can dive into the ICU taking care of intubated patients on pressors who are getting a lot of, fluid resuscitation and those kinds of things. Or you might also get to be in a ward with patients that are talking to you. And so the variation in ability of nursing practice on the ship is pretty broad and it's really exciting.
Wow, that's so hard to wrap our head around, right? We're used to the regular hospital where you have your competency and you have your specialty and you have to have training for those things. So that just brings up a question, but how do you train for something you're not familiar with? If you worked in just a regular pediatric medical surgical unit, how do you take care of those higher acuity patients?
Yeah. I think something that I was very impressed with was that the commitment to excellence on Mercy Ships. They have nurse educators on board, and they aren't
Really?
letting you near a ward until you have competently completed skills checklists and that you have shown that you are able to safely document on their paper care plans. And so they are making sure that you are ready to go. I really appreciated that. I also think that there is a fair amount of just interviews and application processes that kind of make sure that the right people are on the right ship at the right time, so that you're not getting put in situations where the quality of care that we would provide in our home country or in our home organizations should not differ on the ship. And they do a very good job of making sure the ship is not the place to practice. The ship is the place for you to show up with the skills that you already have, and the evidence-based practice you already understand to be able to adapt what you're doing to that resource, the level of resources available so that the patients, their care is just as good on the ship as it would be in a Western country.
So, what is the logical perspective of this? I mean, do you go to your boss and say, how long are you gone for? And how do you make those arrangements to be gone away from your full-time work?
Yeah, Vicky, that is the question. That is the question. I think that a lot of the population on the ship will be people who are maybe they're going to travel nursing. And so they'll kind of take a gap in between when they start a travel contract. There's other countries in the world that have, they get leaves, like they get a yearly annual leave. Australia is one of those places. And so a lot of the Australian healthcare providers were on their annual leaves. For me, my boss is very grounded in making sure that our cups are filled as professionals and that we are grounded in service. And so when I brought this up to her as something that I wanted to do, she did everything in her power to partner with HR, to make sure that I was able to step away from my job responsibilities to be able to go. So it's not easy, but it's absolutely doable if it's something that you're really interested in.
So how long is a typical rotation, I guess, on the ship?
Yeah, it depends on what role you're going into. So, for example, sometimes the PACU roles, if you're working in PACU, can be a little bit shorter, around 2 weeks. The minimum amount of time a ward nurse or could spend on the ship is 8 weeks. And the reason for that, you can imagine, by the time you get there, get over your jet lag,
Right.
you have everything ready to go. You need to be there for a little while to be able to kind of get the ball rolling and feel confident and comfortable. So the minimum time for a ward nurse is 8 weeks. And then you can do much longer, obviously. So I got to be on the ship for 3 months.
Wow.
Yeah. Yeah, it was so fun.
Yeah, that's amazing.
Hmm.
The risk manager in me, because I've done risk
Yeah.
management, goes to what are the risks involved in this? I mean, I'm imagining pirates out on sea, how do you keep the ship safe? I mean, all of those kind of things. How is it maintained for the not only the healthcare team, but also the patients that you're working with?
Yeah.
Yeah. I mean, that is the question. Vicky, you're asking all of these big questions. So I think the first thing is that the ship goes where the ship is wanted, meaning that Mercy Ships creates incredible partnerships with the countries, with the host countries. And so we are there because the government wants us there and they want our support. And so when we are going into those countries, we not only we have the support of that country, the military in that country, the people in those countries because they're happy that we're there. And so when the ship comes into port in a country, typically there's dancing and flags and it's a very happy occasion. And I think the other thing is that the ship is this self-contained environment. It has food, it has water, it's climate controlled, it has security, very robust security. And so if there was ever political unrest in a country where the ship was at, all we would have to do is just sail right out to sea. And so it's this beautiful, self-contained place that creates incredible partnerships with the countries we're in. But if there was ever any reason that volunteers needed to be safe or kind of be removed from the country, that's also possible too, because it is a self-contained environment that's stabilized.
Yeah, I see that it would be, a lot safer than some of the medical missions that, go on now. So,
Right. Well, and even imagine like power outages. If you've ever been overseas, you'll see the power going on and off. Well, can you imagine how detrimental that would be to a surgeon in an OR? You can't. It's not safe. And so the backup generators and all those things that are typical practice in our healthcare facilities in the US, the ship has those exact same things.
I have so many questions. Like this is such a great, what a great mission and how altruistic. I mean, it's really great. Do the staff, do you have to have vaccines to go because you are typically going to the continent of Africa, or are there other places you're going? Are you allowed to, do you always have to stay on board or can you get off the ship? Because then you've got a safety issue potentially there. So,
Yeah. So yes, vaccinations, 100%. Anytime that you are leaving the US, it's best just to go to the World Health Organization and know exactly what vaccinations are recommended for the countries that you're going to. But even the Mercy Ship's onboarding process has that very clearly outlined with health evaluations and stuff. So depending on what country you're coming from and what country you're going to, they will make different recommendations for vaccinations. So absolutely a necessity to make sure that you're safe on the ship. And Andrew, remind me of what your other question was after that.
oh, I was just curious, if you get into port, you work your shift. We didn't discuss how many hours your shift is, but if you're allowed to get off the ship, how do you maintain safety in that regard?
Yeah. So we have badges, and so we can absolutely get off the ship. That's one of the most fun things is that you actually get to go off ship into country and get to know people and go shop and try food and all of those things. So we actually have badges as part of the security protocol. And so when you leave the ship, you badge off the ship. And then there's actually a curfew for safety reasons so that they know exactly what time to expect you back. And if you're not back by that time, then obviously there's other protocols to make sure that you're back. But there's safety briefings, there's updates weekly, if not daily, if they recommend you stay on the ship or what those kinds of things look like, areas in the town that are safer to go to, recommended spots. So the ship has a very good relationship with the local government and police, and they communicate very clearly to us what's safe and what's not. But in Madagascar, one of my favorite things to do was take a tuk-tuk up to the beach, and we would just go to these little cabanas and have, coconut water and after our shift and just watch the sunset. So it's pretty special.
So this really brings together all sorts of different cultures and backgrounds. How did you learn how to care for these patients in such diverse care settings and just their culture?
Yeah. Vicky, the interesting thing is like the ship, we are a guest in Madagascar. So we're really going into their cultural norm. And there are so many more Malagasy people or whatever country the ship is in on the ship than us foreigners. And the other thing is that the ship is already its own global environment. So it's not like the shift is only staffed with Americans. I was a minority. The shift had Australians, people from the Netherlands, people from the UK, people from, there were nurses from Nigeria. Like it is New Zealand. It's so global. And so it's not even just necessarily the patients that make it so global. It's all of the healthcare providers. And, there's this concept in African culture called Ubuntu. And what that word means is I am because we are. And there is this intricate intertwinedness of our humanity and reliance on each other. And how that kind of plays out on the ship is like, I'm working in a hospital. I can't make my own food. So the people who are volunteering from the Netherlands who are making lunch for us is intricately involved in surgeries just like I am, but in a different way. And on the ship, there is no role that is more important than another one because if we don't have electricians on the ship to keep the power going for the OR, then there's still not surgeries happening. And maybe some of the electricians are actually, from Germany. And so that environment cultivates the spirit of Ubuntu and also cultural humility because it shows like we rely on each other and there's this interconnectedness that we can't function without each other. And so I think that is how it's kind of embodied to me. And in that regard, it wells this like deep respect in you for other cultures versus having it feel different or strange.
Yeah, it almost reminds me a lot of we're taping this right in the middle of the World Cup and seeing what's going on across, the United States and learning the new cultures and different cultures kind of reminds me of that. It's become this global melting pot for culture. So
Yes. And it makes it more fun.
mhm.
It enhances it.
Yeah, definitely.
Yeah.
That's really fascinating. What a blessing to get to meet all of those people. So I'm going to swing the question and segue into something else. But given that you are floating hospital, how do you deal with resources, especially if resources get low, if something goes wrong? I think of blood is number one. I would assume, is there a blood bank on ship or how does that work?
Yeah, such a great question. Okay, Andrea, so one of my first misconceptions with Mercy ships was someone was like, is the ship going to pick you up in LA and like take you over to Madagascar? And the ship is fully docked. So like we go to the ship, but the ship's not moving. Can you imagine doing a surgery with the ship like, going over?
Yeah.
So I will just like name that. The ship is fully docked and fully stable. So it's not moving everywhere. As far as resources go, there are shipping containers that will bring different supplies to the ship depending on what the need is and what's been ordered. And I think, resource allocation on the ship, your mind is constantly going to that. In the healthcare system in the US, it feels very like disposable. Like we just burn through product. Oops, I dropped that, throw it away. Oops, and on the ship, there's just a different mindset and awareness that the shipping containers coming with more of this supply in 2 weeks. So what we've got is we have to make it last. And that mindset that everyone is committed to, I think really helps ensure that we're just all being mindful of what we're using and even what procedures are being done. If we know the shipping container is not coming till next Tuesday, we might wait until we do a certain procedure for that day. As far as blood goes, this was one of my most mind-blowing experiences on the ship. So when you arrive to the ship, they actually hand you paperwork and they say, "Do you want to be part of our blood bank?" And so all of the volunteers on the ship are actually the donors. And so you can sign up to get a type and cross yourself. And so I'm A negative. And so what would happen is we utilize Teams for communication on the ship. And so we would get a message that said, "Hey, we are, going to do a surgery on Thursday. The patient's B positive. We're anticipating, we want 8 units on call for this surgery." And so they will get people lined up the day before or the day of the surgery to donate to make sure that they have the volume of blood that they need for that specific patient. And one of my favorite things, they didn't need A negative while I was there, unfortunately, so I couldn't do it. But another nurse, her patient was in the OR and was just finishing up. She was going to admit the patient back to the ward. She went, donated her own blood, and then walked to the ICU and hung her own bag of whole blood for the patient she was recovering. I, I will never get over the beauty of that and the gift of that. And sometimes with our blood banks and just the different protocol we have, there's some degrees of separation that we experience as nurses in the US. And so to watch that happen firsthand on the ship was very powerful for me.
Wow.
Yeah, that's pretty incredible. And I can only imagine, I mean, just describing that and describing a couple of the other stories you've told us, how physically and emotionally intense this experience has to be. So, how do you maintain your own resiliency and well-being while you're doing this work?
Yeah. I mean, imagine living with your coworkers, but they're
Yeah.
all but they're all jet lagged. And then their diet restrictions are just all completely out of whack. Yeah, it's complicated and it's messy. And I think there's a level of self-reflection that you have to be able to do when you work in a setting like that in order to be self-aware of what you need and what your values are. I think burnout or fatigue really happens when you're doing something that is not aligned with your values. And so for myself, in my faith tradition, there's this concept called Imago Dei, where other human beings have innate worth and value because I believe they're made in the image of God. And with that, that affects how I interact with someone. If I'm grumpy and I wake up in the morning and I didn't get the breakfast I wanted and I just want to be really salty, that doesn't align with my values. So my behavior is not aligning with my values, and that's when you start to feel off and feel weird. But it's like, hey, these people matter. They're volunteering their time. It changes how I interact with them. And so I think for me, it was really being grounded in my values that created an underlying resilience for me. And I think the other thing that I can say is that for the most part, it was actually quite rejuvenating. I think as nurses, sometimes I'll convince myself like I need a 2 week vacation. I just need to step away and get a break. And that can work. But I don't think that's necessarily the cure for burnout. I actually think the cure for burnout is job diversification. So there's a reason why you became a nurse. Remember your why and put yourself in a situation that's going to remind you of that. And so that's why I think volunteering for nurses is so important because a lot of times it removes the red tape, the infrastructure, the data, um,
Right.
behind those things that can kind of fatigue us. And it can really remind you of your why. And then you can go back into the clinical setting that you were working in with a brand new perspective versus, I went on a 2 week vacation to Hawaii and it was nice to step away, but I haven't really refilled my why. And that's still kind of empty. So I think for me, it's all about knowing your why and putting yourself in situations that remind you of that.
Yeah, and I love this because I studied sabbaticals in my doctoral program as a method to combat burnout and to enhance resiliency. And I see this as like, man, this would be a perfect sabbatical for a nurse to
Mhm.
be able to see the world, but give back to the world. And, there's all those different things. Do they have like a gym on the ship? I mean, a place where you can kind of go and get away and take care of yourself from a physical standpoint as well?
Yeah, absolutely. There's a gym on the ship, so there's like run clubs on the ship. For me, I liked running outside, so I would just go run around the port. It's a very like physically active place. They'll do like pick up basketball, or they have bikes off the ship that you could go ride around. So they do a really good job of enhancing like total person well-being and making sure that you're taking care of your body while you're there. And I actually trained to climb Kilimanjaro while I was, in my off time from the ship. So
How
there's
fun.
opportunity for that.
Yeah. I'm
Wow.
wondering if they have a role for a nurse like me that hasn't taken care of a patient for a while, because this sounds, so fascinating.
Yeah, I think that those kinds of questions come up too, Vicky. Like, would they have a spot for me? And I think that's why it's so important. Just reach out to them. You never know what opportunities they have available, and they're very organized. So yeah, if there's specific questions like that, they can definitely help out.
I just think this is amazing. And I think it kind of segues into my question is that, what do you feel like was the most profound or transformative experience you've had as a volunteer? And how did it change your perspective, especially going back to the Children's Hospital? And you
Mhm.
said it was LA, correct? Yes, LA.
Uh-huh.
Yeah.
Yeah. Oh gosh. Okay. I think I have a bigger, like broader example that kind of narrows itself down. But when you get on the ship, they'll do different in-services that are just educational to kind of help you adjust to the culture or even process what you're experiencing. And we had an in-service on the concept of poverty. And they asked a lot of us, many of us who are from Western countries, like, what do you define as poverty? And, when you sit there and I'm like, this is a trick question. So y'all want to come up with the most like thoughtful answer. And it was just poverty is a lack. It's a lack of something. And the thing usually for Western cultures is material things. So a lack of food, a lack of clothing, a lack of shelter. And they put up this on the screen, this big diagram of different systems that run our society and how those systems have connected poverty to it. So they talked about the economic system, and that if that's not working correctly, it can create a poverty of being, meaning you don't have what you need, your clothes and your food. They talked about political systems. And when those are not working correctly, there's a poverty of stewardship, meaning that the things that some people have and some people don't. They talked about religious system poverty, and when those things are not supporting people in the way that it can, it creates spiritual poverty for people. And they talked about social systems, and when you don't have a robust social system, that you have a poverty of community. And so with that, there's so many different kinds of needs we have as humans and different kinds of poverty we can experience. And so when I think about poverty in the US, I think that right now we're seeing a mental health crisis, right? Like the data shows us that there's a huge poverty of community. I think a lot of that has to do with social media, connectedness, all of those different things. So when we are able to name the poverty that certain cultures are experiencing, it levels the playing field. So I don't walk into a room saying, I have what you need and I'm going to give this to you. It brings down the power, and we all as human beings have and need. And when I might have a poverty of community, you might have a poverty of being. And when we can connect with each other in those ways and serve each other, it creates a mutual environment, back to that concept of Ubuntu versus I have and I'm going to give to you. And when you approach service in that kind of framework, the person receiving the services, it feels different. I believe it can heal in a deeper place. And so with how they broke that down for us, being in an environment where volunteers are aligned in values, meaning like, a lot of our meetings at hospitals start with our mission, vision, and values. This is why we do what we're doing. I have never worked in a place that was so truly value aligned with the volunteers. No one there's getting paid. Everyone left something behind. And so when they would send out a shift alert saying, someone called out sick from their night shift, I couldn't even type fast enough to pick up the shift because someone else had already said, I can do it. I've never worked in a place like that ever. And so to be in a place that was so mission connected and values aligned was so powerful to be a part of. And it just makes me crave it to be a part of it where I work now, even though it is such a values driven place. But that was powerful for me just to see. And lastly, I think on a personal level, one of the most transformative experiences I had is Mercy Ships has a pillar of their service called ETA. It stands for Education, Training, and Advocacy. The goal is that we're not just going to countries to provide surgical care, but that we provide education, training, and advocacy for their healthcare system to the point where Mercy Ships doesn't have to go back. They can do it on their own. And so there are off-ship classes. There we partner with local universities. We bring surgeons onto the ship where they can get fellowship hours training under other surgeons. We actually had nursing students. We had Malagasy nursing students on the ship with us. And so several of the days I got to work alongside one of the Malagasy nursing students, and she was just sharp. Like her pediatric med calcs were on point, her respiratory assessment incredible, how she was like analyzing surgical sites. I was so impressed. And she was giving NG tube feeds to babies who'd had like a cleft lip and palate repair. And we had a lip ablation that had opened up, and she was doing wound care on this lip ablation. And I was debriefing with her at the end of the shift, and I asked her like, what was the best thing you saw that you feel like you'll walk away with in your back pocket when you go back to clinical care? And I was sure she was going to talk about wound care. I was like, yes, like that was so cool. That was like would have been a bucket list thing for me when I was a nursing student. And she sat there for a second and just took a deep breath. And she said, Laura, the biggest thing I learned today was that you just have to be kind. And it kind of made me emotional. And I kind of questioned her further, like, what do you mean? Like, you are human sunshine. And she just said, sometimes in especially resource strained environments, you almost have to disconnect yourself from the work that you're doing to be able to survive, to be able to keep your head in a space where you're not getting so attached or getting emotionally wrecked with every case. And she said, I saw that kindness is healing. And I will not forget that. I just hearing that from her and from the work I know is ahead of her and in her landscape, kindness is healing. It doesn't matter how many resources we have. It doesn't, all of those things. Yes, it helps us be robust, but that was one of the most transformative moments for me, was taking the time to sit and just talk to people and to be gentle and to be inclusive. That really matters.
Well, Laura, you're just blowing me away. I've got like so many little notes here to go back and
Me
look
too.
at. But what is your next adventure in nursing? And I understand that you might have your own podcast of your own.
Yeah, yeah. Well, thanks for asking, Vicky. Yeah. You know, I am passionate about education, and I can get a little bit theoretical. And so in nursing, we do a really good job of teaching people how to cognitively understand something, like why you would need to place an IV on a certain patient. And then we do a great job of teaching the psychomotor skill of like how to actually place that IV. And then there's also the affective domain of learning, which is how are you processing the skill that you're doing? So you might know why you need to place the IV cognitively. You might be able to do it with under the psychomotor domain. But what if you're placing an IV on a patient who whispers to you, I don't really want to take any more treatment, and the only reason I'm doing it is because my family wants me to? That domain of learning we have a very hard time tapping into in educational settings and in healthcare. And so I have a podcast coming out called Effective Mindset, which really helps nurses in their first year of practice lean into the affective domain of learning to learn how do you process those things in order to create a resiliency that's fundamental for the rest of your practice.
Wow, that sounds
amazing. That's
Yeah.
really great.
It's exciting.
So I do have a question. How many times have you done the volunteering? One time for 3 months, or have you gone back again?
I have only gotten to do Mercy Ships one time for 3 months. So the goal is to hopefully go back again, but maybe save up some PTO before I do that again.
Makes sense. So if another nurse would say, I'm really interested in this, what advice, encouragement would you give to somebody who'd be considering volunteering and for their professional growth, development, all of that good stuff? And how do they get started?
Yeah, I think the first thing is you have to be grounded in your own practice, and you have to understand the evidence behind why you're doing something so that when you are in that setting, you're safe. And I think going to Mercy Ships, I think, is on most nurses' bucket list, or doing some sort of a broad mission trip. But then it's like the timing doesn't ever feel right. So what I would do is just encourage people to do a little bit more research so that when the timing is almost aligned, you know a little bit more information versus just this pie in the sky dream. And go to their website. mercyships.org has a whole bunch of information. They have a very supportive team that can answer any questions that you have, so that when the timing does align for you to be able to step away and do something like that, you already have some of the bigger pieces or the questions answered so that you feel comfortable taking that next step.
Well, Laura, I just can't thank you enough for spending time with us today and sharing your expertise and just your passion around this. And thank you for your service. You've got to be a pretty brave individual to jump into something like this. And so thank you for doing that.
Thank you for having me. It's always fun to talk about, and I hope that this inspires other nurses to take the next step too.
I
Well,
hope so too.
Yeah, and we also want to thank our listeners. We love receiving your feedback on this episode and any ideas for future episodes. You can reach us at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's membership, offering members special discounts, clinical resources, and unlimited free CEs, with information on how to join available at www.aacn.org/discover AACN.